Welcome back to Bernama today. My name is Zaini. I'll be with you with Dr. Lee Jiao Shern, chiropractor,
Yes,
or
nice to meet you.
famously known as Dr. Shane.
Yeah.
Welcome to Bernama today, Doctor. Okay, I have this spine thing on my table here. It's a large spine. So tell us a bit about chiropractic practice.
So chiropractic is a non-surgical conservative treatment for any musculoskeletal disease.
Okay.
So we don't use any medication or perform any invasive procedure.
Okay.
We mainly treat our patients through chiropractic manipulation,
Okay.
Physical therapy, and also use of some machines.
So are you akin to orthopedic?
I would say that we would refer our patients to orthopedic surgeon when it's necessary.
I see.
For example, when the patient has some fracture, infectious disease, or they have any ruptures of ligament that require surgical repair.
I see.
We don't work that closely with orthopedic as compared to physiotherapists because we are largely in private practice rather than being in the hospital.
Okay, how would I know that I need to go and see a chiropractor?
Whenever you have a neck pain, a back pain, numbness on the hands and fingers, you notice any imbalance on your shoulders, or someone tell you
Imbalance in shoulder, how does that feel? You
if you
feel
look,
like
you look at the mirror, you notice that one part of your
Drooping.
shoulder, is dropping down. It could be due to scoliosis.
Scoliosis.
Correct.
What is scoliosis again?
Okay, I'm
Okay,
just going
yes,
to use
you
this
can
thing,
bring
yeah. So basically, scoliosis is a curvature of the spine towards the lateral part. So this is your skull,
Right.
your face is over here.
Right.
Any curvature of the spine towards the side is known as scoliosis.
Scoliosis.
Yep, it's commonly affect people below the age of 12, and then it will actually, the chances of progression will reduce as they grow older.
Oh, scoliosis it will hit the children.
Yes, actually.
I
Yep.
see.
So most of us will have some form of scoliosis, but anything below the 15 degree is considered normal.
Is it true where they say you get a spinal problem when you get older?
Yes and no, because spinal problem can affect young people as well.
Okay.
This is why I have a lot of people in their late 20s, early 30s who come to the clinic and see me. But it affects older people due to degeneration.
I see the slide there. That is an old person on the right and or the same person.
Oh, it's the same person. On the left is someone with a normal posture,
Okay.
and on the right is someone in a slouching position.
But sometimes you do have people who are born that way, right?
Yes, it could be due to a previous fracture on the thoracic spine, which is the middle back.
Is it more genetic rather than more of your lifestyle?
It has more to do with the lifestyle.
Now in Malaysia, chiropractic, how popular is it?
It's getting more and more popular because people are more aware of the existence of chiropractic, and there are also more chiropractors around compared to 10, 15 years ago.
Right. Why is the increase in chiropractor now?
One thing is, of course, because of the prevalence of back pain and neck pain is starting to increase due to the rise of electronic device.
Okay.
And another reason is also Malaysia. IMU specifically, where I graduated from.
International Medical University.
Yes,
Okay,
it's
IMU.
the only university in Southeast Asia that provide chiropractic education.
Okay. Looking at this now, is a compressed neck as compared to a normal neck.
Correct. So on the left is how your neck would look like in a normal posture, and on the right side is how it looks like if you maintain a poor posture for many years.
I
So you
see.
can see the curvature of the spine is actually reduced. It's starting to get straight.
I see.
So this possesses a very important, serious problem, because when your spine is in this kind of position, degeneration occurs faster.
I see. You get older faster.
Yes, in a way.
What will it affect the nerves and all that?
Yes, because this is something we call cervical spondylosis. Basically means degeneration of the cervical spine. So what happened is the disc space between the bone actually decrease. So the chances of compressing the nerve root increases.
Yeah.
So once that happens, you start to develop pain on the hands and also
The numbness and all
on
that,
the
yeah?
fingers.
Okay.
Correct.
Right now in Malaysia, usually when we have this, a lot of people in the rural, or even the town people, will think of the traditional healers, right? Because we have alternatives here as compared to the United States. They will think of chiropractor. What would you say to this kind of people?
One thing is about personal preference,
Yeah.
because some people prefer to be treated by a traditional practitioner.
Right.
But my advice is, if you notice something signs and symptoms that is serious, you should always consult a chiropractor, a physio, or an orthopedic surgeon. Because a lot of times you can have mechanical pain that overlaps with something more. For example, I had a patient who had a back pain.
Right.
He came to see me about 3 years ago. Okay, so at that time, we were doing some conservative treatment for him. His back pain improved, but he still complained of that dull, aching discomfort at the base of his buttock. So I told him if he noticed any changes in terms of his bowel habit, and he told me that he found blood in his stool.
Oh, that's a telling point, right?
Yes. So immediately I told him to go and see a GI specialist.
I see.
I wasn't sure what was happening, and they did an MRI. They found a tumor at his.
It's cancerous.
Yeah.
Okay. The popular thing about chiropractor, we have this visualization chiropractor. We go to you, you will crack our bones.
Correct.
Is that what you do?
It's part of the treatment.
Part of the treatment.
Part of the treatment.
That is your signature treatment, I think.
Yeah,
right?
signature treatment. Yeah.
Okay.
So that is to help to restore the curvature of the spine, to keep the joints more mobile and flexible. And we also do some dry needling.
Dry needling?
Yep.
Something like acupuncture?
Slightly different.
Okay.
Okay. To release the muscle tension. And we also prescribe some stretching exercises, strengthening exercises.
Can you show a bit? How do you do that?
Sure thing, sure thing. So we mentioned about having neck pain just now, the posture syndrome.
Right.
So what you can do whenever you have some sore neck is
I do that all the time. I have that all the time.
First, you can put both of your hands on top of your head.
Okay. My jacket is in the way.
It's all right. I'll do it. Okay. And then you tuck in your chin a little bit. Okay.
Tuck in,
Tuck in your chin a little bit and pull it down.
Ah.
So this would help to ease off the muscle tension around the scalene, which is the muscles around the back here, and release some occipital muscle.
Where can they get in touch with you?
Oh, okay. So
you have a website or your Instagram?
Yes, I do. My chiropractic clinic is known as Axis Chiropractic Damansara.
AXIS?
AXIS.
Okay.
Correct. Chiropractic Damansara. We are located in
Bandar
Utama. Oh, is
I
it?
can't see it, but I think it's there.
Yes, and you can do some searching on Google. You should be able to keep in touch with us.
Okay. Dr. Lee Jiao Shun, or commonly known as Dr. Shane, from Kelantan.
Yes.
Yeah, so you're making chiropractic into something which is, I think people should try to take care of the back, because the back is where you rest all your weight on.
Correct.
You know? So this is, any last words to them?
Keep yourself moving,
Moving?
Yep, correct. Don't spend so much time sitting down. Do more exercises.
Moving as in what way?
Standing exercises.
Or don't be stationary.
Yeah, correct. Because very common, my patient would tell me they spend 7-8 hours, doing accounting stuff.
So if you do have a desk job, try to move.
Exactly.
Every certain time, a certain duration, half an hour.
It makes a lot of difference.
Right. Okay. Thank you, Dr. Shane.
No problem.
With that chiropractic, I mean, bring more spines in the future. But I think it is something that we have to know about our own spine. Yeah, for us to be healthy until we are old.
Yes.
Yeah. Hopefully, we can keep young when we are old. So thank you again, Dr. Shane. That is about chiropractic, and I hope you have some information, some good exercise tip from Dr. Shane just now. So with that, I'm Zaini Yohi for Bernama Today.